Hello and welcome to today's discussion on the Washington University Orthopedic Injury Clinic. And today we have with us Dr. Scott Simpson, the Associate Director of the Injury Clinic, and Physician Assistant Patricia Gorenc. Welcome and glad to have you guys on. And let's just get right into talking about the Injury Clinic. And can you guys tell me, how does a typical visit go?
Sure. So with the typical visit, our processes have changed a little bit now during the coronavirus pandemic. In particular, people used to just come to the clinic and walk in, and it was sort of a first come, first serve, and there may be a bit of a wait. What's changed a little bit is that now we're asking people to call ahead and schedule a same-day appointment, which has the benefit of it's allowing us to space patients out a little bit more. So a lot of the time our wait is a little bit shorter. But there is still sometimes a wait to be seen potentially. But patients see either a physician, a nurse practitioner, or a physician's assistant, but all of us are orthopedic specialists. So that's one advantage is seeing someone with specialty in orthopedic care. We do have the ability to obtain any necessary x-rays. We have on-site x-ray. So we will typically review those with the patient in the room. That's one advantage of the injury clinic. And a part of a typical visit. Most visits do involve obtaining x-rays. And then once the injury is evaluated and potentially x-rays have been obtained, we'll discuss the need for any potential bracing or casting if there's a role for that. And then we always discuss follow-up care for the injury, be that follow-up with a specific provider who saw the patient in the injury clinic or potentially follow-up with one of our other subspecialists within the orthopedic department. Not all visits necessarily require a routine scheduled follow-up appointment, but a lot of the time we do arrange follow-up care.
Patricia, what would you say are some of the benefits of the injury clinic versus the urgent care?
Yeah, so lots of people have that same question, right? So their kid falls off the monkey bars and they don't really know where to go. And sometimes they call their pediatrician, who might give them good guidance on what would be the best place to go for the specific complaint. But we, for orthopedic conditions, hold some kind of advantages over the traditional urgent care setting. One is what Dr. Simpson had just mentioned, which is that we can obtain x-rays and we can review them with you. So we're all trained in orthopedic specialists and we can review our own x-rays and can go over those with you specifically, not needing to wait for a radiology read. Typically for most insurances, I think we're billed like an orthopedic specialist visit. So just as you would see if you made an appointment with us, which is different than your typical urgent care copay and usually is a little bit cheaper. So that's an advantage. Again, you're seeing an orthopedic specialist and one that you likely will end up following up with your care, which is nice for the continuity of care to see someone. And again, we're all trained in orthopedics, so often we can kind of expedite your care, make sure you're getting the correct x-rays and that won't need to be later repeated. If you need a cast, we have the ability to put those on in our office, which isn't typically available to outside urgent care. But yeah, so several advantages, certainly. I think the primary one being that you're seeing someone who's specifically trained in orthopedics, isn't just kind of a general medicine that's going to kind of triage you and then send you over to us eventually anyway, which often ends up with a duplicate visit, which is more expensive and in time use.
What are the issues that we or you don't see in the injury clinic?
Sure. So we do see a very broad range of orthopedic issues, but there are some certain things that we don't necessarily see in our clinic. Probably the biggest one on that list would be concussions and head injuries. So head and facial trauma and concussions are things that we don't typically see in our injury clinic. And so those typically are patients we would ask to call to schedule an appointment with one of our specialists who does see those issues or consider the emergency room if it's a severe enough injury to warrant considering that. The others are lacerations or open wounds. So we don't typically sew lacerations up in our injury clinic. Open wounds in conjunction with an injury or an infection risk, and we're not really equipped to evaluate and manage infections in our injury clinic. So that would be the next thing, infection, in particular joint infection. The reason we aren't really well equipped to manage infections in general is that those often require further evaluation, be that more advanced imaging like an MRI or potentially laboratory work. And we don't have access to an on-site lab, so we can't rapidly obtain laboratory work the way they can in an emergency room. So in general, an emergency room is a better place for evaluation of a potential infection. And a joint infection in particular is something that needs to be evaluated very quickly. So since we don't have that capability, we're not necessarily the best place for that. There are a couple other things, abdominal pain in particular. So we do get people coming in sometimes with pain in their abdominal area. That's rarely a musculoskeletal issue. Most of the time, that's pain related to one of the organs in the abdomen or whatever else it may be, and therefore really outside our area of expertise. Obvious deformity and displacement would be another. So if there has been an injury and the arm is, obviously bent at an angle, that's something that needs to be reduced. Typically not something we're really equipped to do in the injury clinic. And the primary reason for that is that we don't administer any medications. So we can't offer sedation for reduction. We can't give medications to ease pain in order to do a reduction. So for those reasons, those are typically best addressed in the emergency room. That's potentially an injury that may need surgery as well, and therefore something better addressed in an emergency room. Our other rule is that we don't generally see patients who are under 5 years old. That's actually one of our criteria for seeing patients. That said, we do sometimes make an exception to that rule if people call ahead. So in particular, patients who have had an injury, potentially have a break, depending on the expertise and the comfort level of a particular provider seeing that patient, people are welcome to call, and we can ask whoever is in the injury clinic if they're comfortable seeing a younger patient, and sometimes we do make exceptions, but our official cutoff is age 5.
Okay.
Yeah, I think it's helpful to remember too, because that kind of sounds like a long list, but if there's ever a question, our website kind of lists those things pretty clearly for you. You can always reference that to see if it's something that makes sense for you to go somewhere else, potentially like the ER if you're actively bleeding,
Right.
versus come to our clinic if you're concerned that maybe your child broke their wrist or pulled their hamstring or something orthopedic related. But you can always reference that on the website. And then same thing, I think your PCP can give you some good guidance about what's going on if you ever have a question to say, hey, not really sure where the best place for me is, if there's some questions. But the website has a great reference to kind of help you decide if it's a good place to come to us. And if you ever show up to our location and it's not maybe the best fit for what you're here for, we often will evaluate you and send you on to somewhere that maybe is more appropriate. We frequently will see things that would be better cared for in the emergency room, and we just kind of direct you that way and give you some advice and get you to the place you need to be.
Yeah, that's exactly right. Thanks.
When would you say might be a better call or to schedule a routine appointment with one of our specialists in the department instead of coming through the injury clinic?
Yeah, I think if you're already established with one of our physicians, so if you see one of our hand surgeons, let's say, and you have a new hand complaint or concern, certainly if it's an acute injury, you fell, you think you broke your finger and you aren't sure, it's always a good idea to touch base with the person that you already see. You can call and talk to one of their assistants or nurses and maybe get their advice. Often they can squeeze you in for a same day appointment. And it's always best to see the person who knows you if that's an option. Often they'll send you over to see us in the injury clinic if they can't have time or your surgeon's in surgery that day. But certainly if you have someone that you're already established with at our institution, we can usually help you with that. And get you in with the person that you already see. If it's something that's more chronic, so again, it's been going on for a long time, same thing, you may be able to get in with the right person if you're willing to wait a couple of days and not have to maybe see 2 people if we need to see you or get you in with either a surgeon or someone more specialized. And then in that same vein, if someone's already told you that you need surgery, so if you're not going to see a surgeon typically in our walk-in office. So if you're hoping for a surgical consult, that's probably not realistically going to happen in our walk-in setting. We're happy to evaluate you or look at your imaging, but typically we would then set you up with an appointment with the surgeon. So in that setting, same thing, it's more helpful to call our main scheduling number, let them know that someone recommended you for surgery. And typically, again, they can expedite to get you in with a surgeon for those needs.
Yeah. I guess, Greg, I think the one thing I would add would be we get patients on occasion who are seeking what we refer to as a second opinion. So meaning they've already seen someone outside our facility and been told potentially that they may need a surgery, and they're seeking a second opinion regarding that particular injury. In general, that's something that would best be seen by one of our subspecialists within the orthopedic surgery department. So if it's for discussion of a meniscal tear, for example, best to see one of our sports surgeons directly, one of our operative providers who can more clearly provide that second opinion someone's seeking.
We had a question pop up with hip and groin pain that hasn't gone away in a couple of weeks after injury. Is this clinic the best place to go, or would a general practitioner be the first step?
Honestly, I think either one is probably appropriate. We're certainly happy to see people with acute pain after an injury like that. We can obtain x-rays rapidly. Sometimes people do end up getting x-rays through their primary care physician and then potentially referring them on after that, and that's perfectly appropriate. I think one other advantage we probably didn't mention before to being seen in the injury clinic versus potentially having x-rays through a primary care physician is just that we may get a specialized set of x-rays and potentially different views than one might obtain with a general referral for x-rays through a primary care physician. Certainly through no fault of them, these are not typically trained in what specific x-ray views to order for a given joint. And so occasionally we do end up repeating x-rays. But in general, certainly you could go either way. We're happy to see people with acute pain after an injury, a hip in particular. We see quite a few hip injuries.
I think it's also helpful in that regard, just to point out, just the thought came up. If you're considering coming, you have had x-rays done somewhere, your primary care ordered them. It's always helpful if you get those on a CD and bring them. We are orthopedic specialists. We like to see the actual images and not just a report. So if someone has obtained x-rays, whether you saw urgent care and they sent you to us, or your primary care got x-rays and said, oh no, you have a break, we need to send you somewhere to get a splint put on, and they send you over, it's always a good idea to bring it to us on a CD, since they're often obtained somewhere else that we can't see the imaging, and we would hate to have to repeat them for you if you already have appropriate x-rays.
Yeah, that's a great point. We do actually often end up repeating x-rays that have already been done because we don't have access to view the actual films. Typically, just having the report, which we can have facts, is not necessarily enough. We do find that some radiologists, they don't necessarily know where pain is and necessarily comment on something. We may see something they didn't see. So we do really need to see the actual x-rays if somebody had outside films to be able to appropriately use those to manage an injury.
What about office hours, office locations? When can patients see you in the injury clinic?
Yeah, so we do have 2 locations now. Fairly recently, we opened up our second office. So our first one opened up 7 years ago, I think, in Chesterfield. That's off of 40 at 14532 South Outer 40 Road. Our second office is our South County office. So that's down just off of 55 in Butler Hill, and that's been open for 2 years now, I think. So we have
almost 3, actually.
What's that?
I said almost 3.
Has it been almost 3? All right,
3 years ago, September, yeah.
There you go. So we have the 2 offices. Both are open the same hours with the exception of Saturdays. So we're open noon to 6 currently in both locations, Monday through Friday. Our Chesterfield location only is open on Saturdays, and that is 8 to noon. We did increase the hours a little bit during the coronavirus pandemic here. So we used to be open a little bit later in the evening. We've currently backed that off a little bit just because our number of patients went down a little bit. So we're closing at 6 now, where we used to be open a little bit later. It may change again at some point in the future, so something to pay attention to, but currently we're closing at 6 o'clock.
Yeah, and always there's the website that we can direct everyone to check the date, check the hours in case they've changed, or if there's a holiday closure as well.
The other helpful thing is that phone number, the number to call to schedule a same-day appointment in our injury clinic, is on the website.
Yes. And also that helps with scheduling that, but then also with the new procedures is that once a patient gets there, they call the front desk and get checked in that way to help. Again, everyone is safe and social distancing and masks are required. And then also we want to make sure that patients are being asked the COVID questions just to make sure that they're not coming in, and we're making sure everyone is safe. Is there any other questions or anything that you guys feel that you feel like we should address with the injury clinic and patients that come in? Like, I know we've talked about acute versus chronic. What is that timeline? I mean, is acute 2 weeks, 3 weeks, a month? What exactly is that?
Yeah, so to me, I think it varies depending on really whether there's been a specific injury. So if somebody had a specific injury and they're still having pain and it's been a month, certainly happy to see that patient, and it certainly might be related to, fracture, whatever else from that initial injury. I would consider that still basically the same injury. If there's been pain, for months or years potentially, especially absent a specific injury, then that's more of a chronic issue, I think, and not necessarily what we are the target group for our injury clinic.
I think the caveat to that, and I think something you kind of touched on too just a second ago, Crystal, is that there are certain cases, both when deciding kind of where to go, that the injury clinic is serving a really great role for right now with COVID, which is to keep people out of emergency rooms, right?
Yeah.
So you're certainly going to be a lower risk of exposure. You're not around other sick people. Everyone's coming in with an orthopedic complaint generally. And like you touched on, we're doing all the screening, temperatures, masks, all that kind of thing. So really helpful in trying to keep people out of urgent cares and ERs where people are more likely to be exposed to other sick people who have coughs and that kind of thing.
Yeah.
And I think certainly there's something to be said for the fact that we are really geared towards acute injuries and, falls and strains and sprains and breaks and that kind of thing. But certainly if you have a concern about something and it's bothersome enough that you maybe would end up in the ER if you're worried about it, even if it's worsening of something that's been going on for a while, but enough that you're concerned that you would maybe be in the ER, it's definitely worth calling our office and checking. And if we can keep you out of an ER, then we'd like to keep you out of an ER. And you can always call that number and say, hey, is this something that would be okay for us to see you in the injury clinic tonight? Because something's going on that would maybe lead you to an orthopedic problem that would maybe lead you to an ER or urgent care. And maybe we could save you from having to do that.
That's a great point. It is definitely worth calling, especially if the alternative is the emergency room. We are certainly in an easier probably place to go than being seen in the emergency room. It always helps to call. You can either certainly schedule an appointment to be seen same day in the injury clinic, or if it's something that's less acute, you may be able to schedule an appointment with one of our other providers relatively quickly. One consequence of coronavirus right now is that a lot of our providers, a lot of our physicians are not as busy as they otherwise were. So it's actually easier to schedule an appointment a lot of the time. I'm sure that's not universally true, but a lot of the time it is.
Had a question pop up, and discussing insurance. Again, I don't know. I mean, I know the answer to this, but it's is it like an ER visit or a regular office visit co-payment? And yes, it is an office co-payment. You're not going to spend that very expensive co-payment for an emergency room visit. So that was a question. What I had. One of the things that, as being the physician liaison for this department, again, I offer a lot of times to either call the number that, and we'll list that number later, but also I ask people, if you have questions, to call me, because again, I'm available to ask any questions. And if I don't know the answer, I will find the answer. And usually I'll email you two and ask you, is this something we see or not? But I think that, it is definitely making sure that those numbers are out there for people.
Yeah. We're always happy to field those questions whenever there's a concern. If anybody's wondering if we're the right place for them or not, we are more than happy to, field that call and answer that question.
Absolutely. Is there anything else that you guys would like to touch on today regarding the injury clinic?
I can think of, unless there are any other questions from the audience.
No, I think that we've pretty much covered a lot of information, and you guys, thank you so much for joining today. I appreciate your expertise on the injury clinic, and I thank everyone for joining, and thank you.
Thanks, guys.
Thanks,
Looking
everyone.
forward to seeing some of you. Hopefully not in too bad of injuries. We're happy to help if you need us.
Happy to see you if you need us. Yeah.